And welcome to today's American Community Media Weekly National News Briefing. I'm Sunita Sarabji, ACOM's health editor and your moderator for today and co-producer of our weekly national news briefings with my colleague Pilar Marrero. The government shutdown has entered its 10th day, and at the heart of the shutdown is keeping the government open, is healthcare. Millions of Americans this month are set for sticker shock as they see their monthly Affordable Care Act premiums nearly double once enhanced premium tax credits expire at the end of this year. 4 million people are expected to immediately lose coverage because the cost of premiums are too high. 7 out of 10 Americans surveyed in a new poll say they will not be able to afford higher cost healthcare without seriously impacting their household budget. And very low income people stand to lose their $0 monthly premium. These cuts come amid new restrictions around who is eligible for Medicaid. Speakers today will discuss the spiraling cost of healthcare and a possible path forward beyond the shutdown. So please welcome Dr. Ashley Kirzinger, Director of Survey Methodology and Associate Director of the Public Opinion and Survey Research Program at KFF. Jennifer Sullivan, Director of Health Coverage Access and lead for the Beyond the Basics project at the Center for Budget and Policy Priorities. And Anthony Wright, Executive Director, Families USA. We ask reporters to enter questions in the chat. We will address as many as we can immediately after all speakers present. So let's begin with Anthony Wright, who will provide a broad overview of what's at stake in the shutdown showdown. And he will also focus on the hit to rural hospitals and community health clinics. Welcome, Anthony.
Thank you so much, Sunita, and thank you for everybody for joining us. My name is Anthony Wright. I'm the Executive Director of Families USA, the National Healthcare Consumer Advocacy Organization that's been doing this advocacy for affordable, accessible healthcare for 45 years. Good to see many of you here from my previous role, knowing some of you from my previous role as the Executive Director of Health Access California for the last 20 years prior to taking this role. We're here on, as was state, week 2 of the government shutdown, and maybe even more importantly, just a few weeks in front of November 1st, which is when open enrollment starts for people who buy coverage as individuals or families. Let's remember, half of us get coverage through employers, about a quarter to a third get coverage through public programs like Medicaid or Medicare, but the rest of us have to buy coverage as individuals or families, largely on the marketplaces set up by the Affordable Care Act. And those folks, and many of us can imagine being in the situation where we're between jobs, or a divorcee, or an early retiree, or a small business person who needs to buy coverage as individual. And these are vast majority of people are workers or small business owners, or otherwise, who have income but need to buy coverage, and they are going to see a massive rate increase in the next couple of weeks as they head into open enrollment, unless Congress takes action on extending these tax credits that help people afford coverage. In every corner of this country, consumers are opening letters from their health plans, and they are getting an eye-popping increase. And in their regulatory filings, health plans have been clear that a significant part of these spikes are a result of the new policy decisions this year, whether it's Trump administration actions or the health cuts in H.R. 1. These premium spikes are the first of many consequences of H.R. 1, the big budget bill passed earlier this year. And many healthcare consumers are basically going to feel a double whammy. The premiums are rising, and tax credits that would have shielded them and helped them afford the cost of coverage are being reduced or expiring altogether. So the increase, after several years of single-digit increases, We're now seeing the base premium go up by double digits, on average 18%. But what the expiration of the tax credits means is that people will experience it as a doubling or more on average of their premium, a doubling or tripling of their costs, hundreds or in some cases thousands of dollars more. So the key thing I want to be clear here is that these increases are not inevitable. This is a policy choice by Congress and this administration. After campaigning on lowering prices, President Trump and the Republican majority in Congress have failed to lower prices as promised. In fact, when Republicans passed a tax package earlier this year, which extended tax cuts for the wealthy, for big corporations, they repeatedly rejected various amendments that would have extended these tax credits that help low and moderate income people better afford their coverage. Um, but the clock is ticking. They have one last best chance, and that is now, right before we go into open enrollment on November 1. Because what happens then is that when people start to see those increases, even if they may correct them later, there is a fear that people will look at those prices, see that they have to pay hundreds, if not thousands of dollars more, and have the sticker shock that basically makes them fall off of coverage. 20 uh, 22 to 24 million people will see these increases in premiums, and it is projected that around 4 million people will fall off and lose coverage as a result. Um, it's also projected that even if we do this in December, even if these premium tax credits are extended in December, the Congressional Budget Office estimates that 1.5 million people will lose coverage just from the sticker shock and will fall off. So that's the urgency that I want to convey here, that this is not something to be put off. This is something that needs to be addressed now. Frankly, it's already the case that why is this so important, and why is it already a little bit late? Because when insurers, when they are projecting their rates, uh, one of their calculations is, are we going to have a big and broad pool where we can spread the risk and cost of healthcare, or is 4 million people going to fall off coverage as a result of the expiration of these tax credits? And so, if we're going to have 4 million less people to cover, that's going to mean a smaller and sicker risk pool, which means we have to raise premiums. And the projections are that at least 5 percentage points, and anywhere from 1 to 14 percentage points in the filings that health insurers have filed with state regulators, indicates that that 1 to 14% of the rate increase is because of the is because of the fact that they are dealing with fewer people in the pool because of these actions, and that 5% of that is already baked in to our costs. So a long way of saying that this is a double whammy. This both increases the cost, and because people um, don't have the tax credits to shield them, that means it will be an even more expensive cost. So let me give you an example of what I'm talking about. I just came from Maine, where I was traveling to for and a 60-year-old person who makes $65,000 a year. Uh, right now, they pay $462 dollars for a month for coverage. Um, in the last couple of years, that coverage was generally $1,000, but the tax credit got them down to $460. Now the premium in Maine is going up by 24%. And so after a few years of single digit increase, that new premium is going to be around $1,400. And without a tax credit, that person goes from paying $460 a month to $1,400 a month. So literally over $10,000 a year in order to afford coverage. That's the kind of increase that's happening. On average, people will be paying around $700-800 more a year, but especially if you're older, in your 50s and 60s, this is going to be a bigger increase. If you're in certain income areas, or a bigger family, that's going to be a bigger increase. And then the thing I want to focus on is rural, because by definition, people who are in rural areas are dramatically affected by this. If you're in a rural area, that tends to be a higher cost area. There's fewer providers, and as a result, those providers can charge more for their services. And so people in rural areas have particularly high healthcare costs. And these tax credits basically give a guarantee to everybody up and down the income spectrum that you do not have to pay more than 8.5% of your income for coverage. But if you are in a particularly high cost area, like a rural area, and also some urban areas as well, um, you then are going to feel the full brunt of those high health costs. And so that means rural areas will be particularly hit hard. And that means for the rural hospitals, the rural clinics in that area, what does that mean? That means fewer paying patients and more uncompensated care. If you put that on top of the Medicaid cuts that we've been seeing, uh, that will also hit these rural hospitals, community clinics, and frankly, any other type of provider where Medicaid is the main payer, whether that be maternity wards, whether that be um, uh, nursing homes, then those institutions which were already teetering could have to scale back services or ultimately close. So that's why this has an impact not just on those folks who buy coverage as individuals or family members, but for the healthcare system that we all rely on, especially in places like rural areas for and people who depend on community clinics, rural hospitals, etc. Let me pause there, but we can go further. But it just gives you a little bit of flavor of what we're dealing with this crisis that's coming up in the next few days and weeks as we head toward open enrollment on November 1.
Anthony, thank you. There are a number of questions for you in the chat, but I'd like to start it out with a question. Prior to 2020, we did not have enhanced premium tax credits. What did premiums look like then, and how were people able to afford their healthcare if they were?
Right. So when the I mean, prior to the Affordable Care Act, you were all on your own. You could be denied or discriminated based on your pre-existing conditions, on your gender, on your geography, on your zip code. All bets were off, and you didn't even know if you were buying coverage that had any value, if it had any basic essential benefits, or anything else. The Affordable Care Act provided some guideposts and protections. You couldn't be denied for pre-existing conditions. You have to have some basic benefits, and it also provided subsidies in these marketplaces where people who were above the Medicaid threshold, which is about $20,000 for an individual, 20,000 for an individual, around 45,000 for a family of four. Those folks uh, who are underneath that got Medicaid, but those with higher incomes then got us again this guarantee that you don't have to pay for a silver plan more than a certain percentage of your income. The issue is that that percentage of income went up very quickly, from not just 2% to 5% to 10%, like even if you were making something like 40,000 a year as an individual, and then at 60,000 a year, it cut off completely. And so there were people who were like making 60,000 a year who were capped at 10% of their income, but then who were like a dollar over or a few thousand over, who were then paying 20, 25, 30% of their income for coverage because there was no tax credit for anybody who was four times the poverty level, which is again roughly around 60,000 for an individual, 125,000 for a family of four. So what the enhanced premium tax credits did was two things. One is that it didn't have that cliff at the edge of the 60,000. It said the guarantee is that nobody has to spend more than 8% of your income on coverage. And obviously, for folks who are higher income, most people don't hit that 8% because 8% of a big number is still a big number. But if you are, again, older, a rural area, big family, then actually your premium can be in that category, and then you get some help. But it also provided a lot of help for those folks under 60,000 a year because uh, they were their sliding scale is actually now 0, 2%, 4%, 6%, 8%, and a much more gradual way. So again, 85% of the people who get this enhanced tax credit um, are under 50,000 for an individual, 100,000 for a family of four. So that means that they can so this is disproportionately helping low-income people by just lowering their premiums. The Affordable Care Act provided real help, but for some people it was like getting a 6-foot rope to get out of a 10-foot hole. It was really close, but you just needed a little bit more to to get out of the hole and make coverage affordable. And that's what the enhanced premium tax credit did. And as a result, the number of people in the marketplaces went from 12 million to 24 million, literally doubled. And that's why by losing these enhanced tax credits, the estimates are that at least 4 million people will fall off coverage as a result.
Thank you. We have time for just a couple of questions, and I hope you'll answer additional questions in the chat,
Of
Anthony.
course.
Araceli Martinez from La Opinion, please ask your question.
Thank you, Sunita. Hello, Anthony. Good to see you. I was trying to see if you can help us to get information about the impact on Latinos in California. How many could be left without coverage? This is very concerning because, as you know, the gap among our community without insurance has been narrowing. So, and finally, what will be the options and what can be done? Thank you, Anthony.
Great to hear your voice, Araceli. I was I would say that if you look at covered California, has about 1.5 to 1.7 million folks. If I remember my stats from last year when I was doing this focus on California, has about 1.5 to 1.7 million folks in it, and I recall that like over half of the covered California's enrollment was Latinos. Because if you think about it, who are the folks in the exchanges, whether it's covered California in that great state or in healthcare.gov or the other state-based exchanges. These are people who are, again, working, but largely in jobs that don't provide health coverage at work. And in some cases, it's like the real estate agent, the freelancer, the dentists and chiropractors, 25%. But but I think it's also a lot of professions that have a disproportionate number of Latinos. So, for example, 25% of people in farming and ranching are buy coverage on the individual market, over a quarter. Over a quarter of people who I mentioned are on real estate. If you think about it, it's people who are in retail and restaurant workers, in hospitality work and seasonal work, like including maybe some farm workers. It's gig workers, people who drive for Uber, Lyft, and DoorDash. It is the range of people who are working but don't get coverage at the job. And so it's a lot of small business people. So anybody who is running a bodega, running a taco stand, running a barber or a beautician, those are the types of people who are buying coverage on healthcare.gov, on Covered California, and they're the ones who are being directly impacted by these massive increases of doubling or more.
Thank you. Cora Oriel is next. Cora, please ask your question.
Thank you. Thank you so much, Anthony. Very informative. I was wondering, what are the proposals being offered by those against the extension of the ACA? And the second is the state of California has been very proactive in protecting its residents. Does the California state legislatures have protective backstop measures in place?
So unfortunately, the part of the problem is that there's not a plan, right? And the government is shut down. In fact, right now, the House or the Senate aren't even in session. So it would be one thing if they were negotiating this and trying to figure out what do we extend this? Is there some alternative? But there's none of that discussion. They're saying nothing. And again, there was multiple opportunities in the budget bill that was passed earlier this year, the one big beautiful bill, HR1, to try to extend these tax credits while they were extending the tax cuts for businesses and the wealthy. And the fact that they completely rejected it, that's why, we're now at a head at this particular moment. In terms of what California can do, California actually was one of the states that actually piloted this idea of introducing greater affordability assistance. I was proud to be part of that effort along with my colleagues at Health Access California, who you should certainly follow up with. But I would say so there was money that was raised to put into providing help, a greater additional affordability help. And when the federal government did it, they actually repurposed that money to go to buying down deductibles and having improved cost sharing for people in exchange. So right now, if you buy a silver plan in California, this is unique in California versus other states, you actually don't have a deductible. That could be thousands of dollars. It's actually a really great deal. If these tax credits go away, then they have to repurpose that money back to trying to provide some affordability assistance in the premium. But I want to be clear, the amount of money that California devotes to this is about a couple $100 million, when the amount of money that they would lose, that Californians writ large would lose if the federal tax credits go away, is about 1.92 billion dollars. So it's literally fractional. It's literally like 1/8, 1/7, 1/8, 1/9 of what is done. So I think Colorado said that they're going to try to make up some of the difference, but the states that are trying to do this are doing whatever they will do is going to be literally a fraction of what the federal government with all its resources can do. And that's why, again, states can do important things, but not at the scale of what what would be lost by letting these tax credits expire.
Anthony, thank you so much. There are several questions for you in the chat, and I hope you answered them there. We move on to Jenny Sullivan from the CBPP, the Center for Budget and Policy Priorities, who will discuss the loss of $0 premium plans for very low-income people and the organizations Beyond the Basics report. I will drop both of those resources into the chat. Welcome, Jenny.
Wonderful. Thank you so much, Sunita. Thanks for having me this afternoon. I also wanted to add that just a little bit of texture. Our Beyond the Basics project has been around since the ACA started the implementation in 2013. I have inherited a lot of great work from my predecessors, but the project reaches over 6,000 people who are engaged in enrollment assistance or outreach efforts around the country. And every year we do a barrage of webinars and materials to help that community stay up to date with the latest changes. And this year has been a banner year for participation in that community as people try to come to terms with what they need to know to help their communities enroll. So we're in touch with folks that way. And I will say personally, although I have not kept this up in recent years, for the first 5 years of ACA implementation, I did some moonlighting work on the weekends as a volunteer certified application counselor in Virginia, where I live, where we were largely providing assistance to people in the immigrant community here. And so I just want to say that although I'm a policy analyst by day, I bring some different texture to these experiences from other things I've done. So I wanted to touch on 3 things, and hopefully the idea that reinforcing points helps people remember them more, because I'm going to say a lot of things you heard Anthony start us off on, which is not surprising. We're very aligned. But I want to touch on 3 things. Who is at risk if these premium tax credit enhancements expire? Why is it important to preserve $0 premiums? And why is this urgent? So starting off, who is at risk? Well, 93% of marketplace enrollees get a premium tax credit. It is the vast majority of people who are getting their insurance in this way get help to lower the cost of premiums. Right now, who those people look like? Who are those 22 million people? They are people who are working, but they have a low income. 90% of people in the marketplace have income below 4 times the federal poverty level, and nearly half have income below twice the poverty level, which is about $32,000 a year. This is not a lot of money. People who own small businesses or are self-employed, as you heard, make up a large proportion of marketplace enrollees precisely because they are self-employed. They don't have an employer that is providing them an offer of health insurance. That's 1 in 4 marketplace enrollees. We also have more than 1 in 4 marketplace enrollees who are young adults, people who are just coming out of high school, coming out of college, haven't got their foot in the door at a job that's offering them insurance yet, but they are too old to get insurance through their parents. They rely on the marketplace. And then at the other end of the age spectrum, we have people who are approaching Medicare eligibility age. Almost a quarter of marketplace enrollees fit in that bucket of 55 to 64-year-olds who already pay up to 3 times more for health coverage due to their age, and are more likely to have acute care needs. They are relying on the marketplace in large numbers. Finally, people of color made up more than half of marketplace enrollees nationwide in 2024, the most recent year for which we have national data. These premium tax credit enhancements, as Anthony explained, that made coverage so much more affordable for people starting in 2021, led to huge gains in enrollment and coverage rates among people of color, disproportionately large coverage gains among Black people and Latino people in particular. We saw, wait for this number because it's going to sound a little weird, but we saw a 186 percentage point or percent growth in coverage rates among Black people and 158% growth in coverage rates among Latino people compared to before these enhancements were in place. So while I can't tell you the precise number who stand on the precipice of losing that coverage right now by race and ethnicity, I can tell you that the impact will be much, much larger among those communities. And the last thing I want to say about who is covered is just to have a brief word about people who are immigrants and their relationship with the marketplace. First, I think this community is probably very well informed about this by now, but I want to state for the record that people who are undocumented deserve health insurance, but right now they do not qualify for it. They never have qualified for marketplace coverage. They don't now, and that is not something that's on the table as part of this debate. In fact, recent regulations and law changes have sharply reduced eligibility for many immigrants who are in the country legally. That is not at the center of this debate either. We could have a debate about that, but right now what we're talking about are the people who are going to be eligible for premium tax credits and for marketplace coverage next year. And really the real risk is that people who are still eligible are going to be afraid. This climate has already created a terrible situation in terms of people feeling comfortable accessing benefits to which they are entitled. And we're likely to see a large chill effect, sort of a decline in the people who are eligible for these benefits who don't feel comfortable accessing them. Okay, so why is it so important to preserve $0 premiums? Anthony talked about that spectrum that we've got, sort of people not having a cliff if their income goes $1 over 4 times the federal poverty level. And for folks at the other end of the income spectrum, why is it important for them to get premiums for plans for $0 in your premium? We hear suggestions that, oh, we need people to have skin in the game. People will be out of the game if they have to pay even $1, but some folks. Recent analyses from the Brookings Institution looked at that and found that 400,000 people would be unable to afford coverage if the $0 premiums went away. Lost my train of thought again. My notes picked up here. What we saw with the availability of $0 premiums is that many more people at the lower end of the spectrum were finally able to get insurance. They're still paying to get services. This is not free healthcare, but it is incredibly important, particularly for people in states that have not expanded Medicaid. And that is because people with income between 100 and 138% of the federal poverty level, if your state hasn't expanded Medicaid, that marketplace is your option. But it was absolutely out of reach for people before we made the premium tax credit enhancements available to allow people to get in the door without having to pay a premium, which is what they would experience had their state expanded Medicaid, because people don't pay premiums in Medicaid. So incredibly important. I will also say that when you look at who these people are, there have been some contentions that these people aren't real. There's fraud. the data show that uninsured rates among very low-income people went down more in the states that haven't expanded Medicaid after these enhancements went into place. And that is because these are real people who got insurance through the marketplace because it was more affordable because of the enhancements. You can't manufacture a decline in the uninsured rate with sort of mythical fake enrollees. So we could talk more about fraud if people are interested in that. But the last thing I want to hammer home before I hear some of your questions is why this is so urgent. People are going to be looking at their premiums very soon. We know in 6 states, they're already their window shopping period when people can go to the website and see what their premiums will be for next year. That's already open in 6 states. More are going to be rolling online in the coming weeks. And the minute somebody sees something that is as astronomical as the numbers we're talking about, they've lost hope. They're scared. They're worried. And to say, hang on, Congress will get to this. Just come back in December. It'll be fine. Is a bridge too far for many people. And we know that that's precisely why so many millions of people are likely to become uninsured, and more people, as Anthony mentioned, 1.5 million more people because, or if this gets delayed until December compared to if this had been dealt with earlier. The last thing I want to say is that this isn't a surprise. We've known this was coming since 2022. And the ACA was designed for moments like this. The premium tax credit was designed to shield people from market fluctuations and protect people. And the failure to extend these enhancements pulls that shield away and exposes people to a level of economic harm that they're not prepared to take. We obviously all know that prices of everything are up, whether it's housing, gas, groceries, etc. And adding this is insult to injury. It's also not complicated to solve. Lots of problems are hard to solve when we don't know the solution. We know the solution. Congress just needs to get this done as quickly as possible. So with that, I will take any questions.
Thank you, Jenny, for all of that information. I have the first question. I know you've addressed this to some extent, but DACA recipients will also lose coverage. Could you please discuss that a bit?
Sure. So DACA recipients gained marketplace and premium tax credit eligibility in the 2025 coverage year as a result of a Biden administration regulation that was finalized last year. It didn't go into effect in every state because of legal challenges, but people in many states with DACA status were able to enroll in marketplace coverage this year. The Trump administration finalized the regulation this summer that ended people with DACA's ability to get premium tax credits or to enroll in the marketplace at all as of the end of September this year. That was when they were sort of turning that off and requiring people to roll off of their marketplace coverage.
Lori Lee has the first question for you. Lori?
Yeah, sorry. I was wondering if serious disease or death rates decreased after the ACA took effect.
Good question.
Gosh, I might have to phone a friend on that. I think that there is likely to be a lot of data on that, and I'm very specific, looking at specific aspects of morbidity and mortality and specific diseases even. I don't have those statistics at my fingertips, but there's certainly a large body of research that's looked particularly at the impact of the Medicaid expansion, but also of gains in coverage through the marketplace.
Thank you. Henrietta Burrows has the next question. Henrietta.
Thanks so much, Sunita. 2 questions. One, and this would be for Anthony Wright or you, Jenny. Do you think that what's going on now might be a continued effort that was started with the first Trump administration to destroy the Affordable Care Act? And also, I read recently in an article, and I'll have to go back and check where, that the Trump administration has allocated millions of dollars for rural hospitals to stay open. Do you know anything about this?
I can certainly say I don't have any line of sight into Republican strategy making rooms, but I will say that what we're seeing now is akin to an effort to undo a lot of the progress of the Affordable Care Act. It is not repeal and replace. It's easier to just repeal, right? We don't have anything to replace. They don't have any plans of things to replace it with, but the magnitude of the cuts that we are going to see in Medicaid and in the marketplace really reflect an effort to kick it out at the knees, basically. I will let Anthony talk about the rural coverage piece.
Yeah,
Thank you.
just very quickly to keep the time for Jenny, the bill, the HR1, the big beautiful bill, so-called, had $990 billion in cuts to Medicaid. Because people were concerned, rightfully, that this would have such a dramatic impact on rural hospitals and care, they decided to have a political solution of having a $50 billion rural health transformation fund to sort of say, oh, we're doing something for rural hospitals. But you can just do the comparison of 50 billion temporary versus $990 billion of cuts that are permanent to suggest what is if that was a real effort or if that was a fig leaf that really actually does nothing to actually cover the severe cut to rural hospitals. Rural hospitals were already in a tough bind because the economics of rural healthcare are tough, and so they need some help. But in a context where they are cutting $990 billion of healthcare of from the Medicaid program, which is in many cases the primary payer of rural hospitals, it was a small step back that allows them to have a talking point, but actually still leaves rural hospitals in a much worse position.
Thank you.
However, that fund is going forward. They do need to distribute that money by the end of the year. And so some states that you're working in are going to be talking about how they apply for those funds. And it's actually unclear what are the criteria for what Dr. Oz and RFK, Secretary RFK will actually, how they'll actually parse those dollars out. So that's to be decided.
Aitana Vargas asked me to ask a question on her behalf. Do you think an increasing number of middle-class Americans are now less likely to support access to healthcare for undocumented immigrants? Jenny?
I am a data-based creature and I don't have the data at my fingertips to answer that accurately. Ashley might, and I know that she's coming up and going to tell us what real world thinks. So I'm gonna let her answer that if she can.
Okay, super. We will move on to Ashley Kirzinger, who will discuss the key findings from KFF's October 3rd poll. Welcome, Ashley.
Yeah, hi, thanks. Sorry, I was just quickly looking to help Jenny answer that question and seeing. So the last time we asked about federal or allowing states to provide some of their own funds to cover for undocumented immigrants, we found about half of the public supported that. So I don't think we have long-term trend on that, but that's where the public is right now. And so it's the idea of allowing states to use their own funding because the federal funding can never be used to cover undocumented immigrants. So, all right, so that hopefully answers that question. So, hi everyone, I'm so happy to be here today in my capacity as a public opinion expert at KFF to provide some insight into the public's views and experiences when it comes to healthcare costs, and in the context of today's talk, the expiration of the enhanced premium tax credits for people who buy their own coverage on the ACA marketplaces. I've been thinking about the expiration of these enhanced premium tax credits as part of a bigger problem around healthcare costs in this country, which I think is an important context to think about this. When we think about and ask the public about their biggest financial worries facing their family, the cost of healthcare services and unexpected medical bills always rank at the very top of that list, well above rents and mortgages, monthly utilities, and the cost of food and groceries. Just under half of US adults say it's difficult for them and their families to afford their healthcare costs. and 1 in 4 say that they or a family member have had problems paying for healthcare in the past year. And that's even with these enhanced premium tax credits. Black and Hispanic adults and people with lower incomes are particularly likely to report problems affording healthcare in the past year. As we've been talking a lot about, the population that buys their coverage on their ACA marketplaces disproportionately impact small business owners, self-employed, people who work for small businesses, farmers, agricultural workers, as Jenny mentioned, people of color, as well as people living in non-expansion states that are, no surprise, Republican states. And as Anthony mentioned, it would also really impact people making more than 400% of the federal poverty level, which is an important group to think about. We at KFF just recently put out a map of the expected increase by congressional district that I'll drop in the chat that I think many reporters would find useful. So I'll be sure to do that in a minute. But I am a public opinion expert. And so I want to talk about what the public knows about the expiration of these enhanced premium tax credits. And so we fielded this poll right before the government shutdown, and we found that there has been a slight uptick in the public awareness of the expiration of these enhanced premium tax credits, but it's still only about 4 in 10 of the public overall say that they've heard at least some about this, and a similar share of those who buy their own coverage on the ACA marketplace say that. So that means that 6 in 10 people who buy their own coverage on the ACA marketplaces and will be impacted by this largely still have not heard much or not anything at all about these expiration of these enhanced premium tax credits. As we have mentioned, they're getting ready. Open enrollment is going to begin next month, and they're going to get ready to do the shopping, and there will be significant sticker shock when people go to renew their coverage and to buy coverage for next year. And so that's why we have this sense of urgency. So while most people haven't heard about it, large majorities of the public support Congress extending these enhanced premium tax credits. 8 in 10 of the public, and we always talk about how nothing is bipartisan. This is something that there is bipartisan support. We have 92% of Democrats, 82% of independents, and 59% of Republicans support extending these tax credits. That includes 57% of MAGA supporters. So the most ardent Trump supporting base support Congress extending these tax cuts. People are always shocked by that number because they're like, but the Republicans dislike Obamacare. They hate the ACA. Guess what they hate more than the ACA? High healthcare costs. Mm-hmm. So this is one area where we see bipartisan support, because regardless of what you think about the ACA, the act of the thought of your premiums doubling from one year to the next is something that all people can get behind and think that is too much of an increase, right? And we even saw Representative Marjorie Taylor Greene talking about this, that it doesn't just impact her, right? It's not impacting her. It's, even if you're not buying it on your ACA, if you're not buying your own coverage, you have friends, you have family members that are going to be impacted by this. So even though it only impacts a very small share of people, it kind of like collectively, we can think that is too big of an increase, and we know someone who's going to be impacted by this. If we focus on the group that is being impacted, and we've talked about, who this disproportionately is, 70% of those who buy their own coverage say that if their premiums nearly doubled, that they would no longer be able to afford their coverage. So 7 in 10 of those said that they would no longer be able to afford their coverage. And so what would happen to them? So we asked them, what would you do? Are you going to continue to pay for your coverage, even though it's now beyond your capacity for your household finances? Would you go without coverage, or would you try to get insurance from another source, like you're an employer or a spouse's employer changing jobs? And what we see is 4 in 10 people say that they would go without coverage. That obviously, the share who say, or that estimates come up with that will be uninsured, that doesn't exactly correlate, but it's the idea that like the perception, what they think they're going to have to do, and that I think we know prior to the ACA, and we know that people without health insurance have much more difficulty affording healthcare. They were less likely to go to the doctor, less likely to get preventive care, and more likely to have huge amounts of stress in their lives about affording emergency healthcare services. And so seeing that uptick and what kind of mental health as well as physical health impact that could have on these individuals was really striking from the poll. Yeah, and I mean, I guess the last thing I want to say is that does not mean the ACA is popular. It is not. Overall, large majorities of the Republicans still oppose the Affordable Care Act. Large majorities of Democrats support the Affordable Care Act, but this is one area that bipartisans agree, and they want to see Congress to do some action on this. I will say that the caveat, we didn't ask this in relation to a government shutdown. We didn't say, do you support Democrats holding out on budget negotiations with as this is a negotiating tactic? I am not a strategist. I don't know if it's a good negotiating tactic, but I'm just here to tell you what the public support is and what the public's view and experiences on this is. So I'm happy to answer your questions.
Thank you, Ashley. There are a number of questions for you. Shabnam Afsa asked the first question. Shabnam?
I was just curious by just the numbers that you gave right now. You said a very high percentage of people support the extension of these tax credits. That's 92% of Democrats, 82 of independent, 59 of Republicans. But then right before you said only 4 to 10% of the people have heard about the impending increase. And I was wondering what explains this discrepancy?
Okay, so the lack of awareness and then support. So we always ask awareness first. So we ask people whether they've heard about it, and then we tell them what's happening, and then ask if they support Congress or think Congress should extend or should or let the tax credits or let them expire. So we ask overall awareness first, and then we tell them what's happening, and then ask their support on it.
And then what is the reason for this information not penetrating through to the people whose lives are going to be affected by it? Who's responsible for? I mean, yes, I know the media is not doing its job, but what about our representatives like Congress people?
Yeah, I mean, I always struggle with this because people like to place the blame on someone or the media or on individuals for not being aware of how this is impacting them. But I will say that all of us in this Zoom room are paying a lot of attention to this and are still really confused about the nuances and the wonkiness of health policy. And these are people trying to live their lives. They're trying to put food on their table for their families. Many of them are working 2 jobs part-time, which is why they don't qualify for employer coverage, right? So these are the type of populations that don't have the capacity to be following the nuances and the wonkiness of this health policy. And so yes, it's also the responsibility of our lawmakers to be telling the public about this. And maybe that's why Democrats are using this as a negotiating strategy. I'm not sure.
Nestor Fantini has the next question. Nestor, please ask your question. Nestor is from Hispanic LA.
Yes, hello, Fantini, Hispanic LA. And Dr. Kirzinger, you mentioned those numbers that are very concerning. As 7 out of 10 feel that they cannot really afford to hire the healthcare cost. And do you think that all that the frustration is going to translate into more and more effective political pressure in terms of our institutions, the Congress, White House?
Yeah, I mean, I think that it's related to overall economic pressures, right? So we know that healthcare spending takes up a huge portion of household spending. And so as we see our healthcare spending increase at the rates that we're seeing it, we're going to see that the pressure on politicians to address it is going to be part of the economic spending message, right? I mean, one would argue that 2024 and President Trump got elected because his ability to fix the economy. That's the perception. And a big chunk of fixing the economy is going to be fixing healthcare spending.
Thank you. Ling Wang has a question for Jenny, and he asked me to ask it on his behalf. What options will we have once the enhanced premium tax credits expire? And what hope can you give people who fear they cannot afford healthcare next year? Jenny? Is Jenny still with us, or? Oh, Jessica, could you please unmute Jenny?
And now I need to ask you to repeat the question. I apologize.
Yes,
I was scrambling to unmute.
What options will we have once the enhanced premium tax credits expire? And what hope can you give people who fear they cannot afford healthcare next year?
One thing I would say is that it's important to keep in mind that the premium tax credit will still go away, which will be catastrophic for many people. However, the entire tax credit has not gone away. We don't want people to hear that and be, so there is still some financial help for people. Practically speaking, people may need to choose a plan that is a lower quote metal tier, so that it has a higher deductible in order to get something with a lower premium that they can afford. Many people are not going to be able to afford anything, or will look at the trade-offs and say, a $10,000 deductible for $400 a month is not what I'm willing to do. And in that case, people will go without, people will get care community clinics, and I always have to dust off my talking points from 2009. People will, and then
Jenny, you're cutting out, unfortunately.
Oh, I'm so sorry. I'm sorry. Can you hear me, or should I?
Yeah, we can hear you.
You can hear you? Okay. I just said we will have to dust off our talking points from when we were debating the enactment of the Affordable Care Act, when we had to make arguments about how we were all connected, and how when there are large numbers of uninsured folks who have to defer and delay care, they end up needing more urgent care that costs all of us when they eventually get the care that they need. And we know that that has long-term impacts on their health and well-being as well. So that's the path that we're headed down if we start to let these coverage losses go forward.
Thank you. We'll take a final question from Diana Martinez for Anthony. Diana, please ask your question.
Can you hear me?
Yes, I can.
Oh, good. Already in emergency rooms at every hospital, wait times are 9 hours or more for people who are very sick. With all of these pending cuts and the fear that it has brought for people who very much should stay on Medi-Cal in California, and for those who have gone to Obamacare, the fear that they will no longer be able to afford increases. People will be going, obviously, to emergency rooms for their general care. And with hospital staffs, and I have had the misfortune to be in one recently, sitting there for days into nights into the next morning. And hospital staff's already complaining that they're understaffed. I can't imagine, and I would like you to speak to the issue of what impact that's going to have overall in hospital emergency rooms and people's care, and staff's ability to properly care for patients in great need.
Thank you, Diana. Anthony?
Yeah, no, I think that is, I think, a great way to close because it sort of indicates why people should care about this issue, even if they don't buy coverage as an individual. I think many of us can imagine ourselves in a situation where we will need to buy coverage as an individual at some point in our lives. But for those who don't, why does this matter? And it's because it has dramatic ripple effects throughout the healthcare system. If we do have greater costs and of people, millions of people falling off of coverage, that does lead to a smaller and sicker risk pool and higher premiums. But at the provider level, what it means is that those providers, those whether it's a hospital, whether it's an emergency room, whether it's a clinic, that means they have fewer paying patients and more uncompensated care. It means that people who don't have access to primary preventive care have their conditions get worse, and then they may show up in the emergency room with something that might have been prevented if they had dealt with it earlier. It means that those emergency rooms have less paying patients and are just financially more strapped and may have to scale back services, hours, or ultimately close. It means that um, we are not providing care at the front end, but only at the end, but actually in the most expensive, most inefficient way possible, which is at the emergency room on the back end. And that has a ripple effect through the healthcare system that we all rely on. And that's why people should care about this specific fight and as well as the broader set of Medicaid cuts that were in HR 1. You had this big bill that had all these cuts, and there's going to be ramifications. And these premium impacts are just the first of many impacts of cuts. We're going to see more as state legislators start trying to figure out what to do. If they're going to get billions of dollars less from the federal government to fund the Medicaid program, then what do they cut in benefits and services and provider rates? And those emergency rooms will have to deal with those cuts as well. So these are redounding, cascading effects on our healthcare system. But again, the thing I want to be clear is these impacts are not inevitable. Um, we can take action. There's lots of times where Congress passes a bad bill and then retracts it, repeals it, rolls it back after public backlash. And the first thing we can do is have a reaction to the notion of these premium spikes. The first thing we can do is push back to prevent these premium spikes of for individual coverage, and then keep working to prevent some of the other cuts that are coming down the pike as scheduled over the next several years.
Thank you. We're a little bit short of time, but I'd like to ask each speaker for a 30-second soundbite. What would you like reporters to take away from your remarks? Jenny, let's start with you.
Can you hear me?
Yes, perfectly.
Okay, terrific. My 30-second soundbite is going to repeat what I said before, which is that this is a choice. We knew this problem was coming. We know what the solution is, and the sooner we act, the fewer people will be harmed.
Thank you so much, Jenny. Anthony.
I think the question is of action, that folks have agency now to call their Congress members to make this an urgent issue, and to be clear that every day means more premium increases get baked in, and every day closer to open enrollment means more people get sticker shock, fall off of coverage, and we won't be able to get them back. And so that there's a real urgency for this that cannot wait, until some fix that happens in January.
Ashley, final word.
There aren't a lot of things in this country that have bipartisan support, but it is clear that across demographics, across communities, healthcare costs weigh very heavily on U.S. adults. And there is bipartisan support across Republicans, Democrats, and independents for Congress to extend these tax credits.
Speakers, thank you so much for joining us today. We very much welcome your